I'm Dr. Sai, and today I'm going to talk about a myth that is wearing a cervical collar always helps in alleviating the neck pain or it reduces the neck pain. So in reality, cervical collars can be beneficial in certain situations such as after a neck injury or surgery to provide support and limit motion during the initial stages of healing, because when you move your neck more, that will affect the healing process. However, the prolonged use of cervical collars for non-specific neck pain is generally discouraged, and immobilizing the neck for an extended period can lead to muscle atrophy and stiffness. So, in case of neck pain, maintaining mobility through gentle exercises and stretches is more beneficial than prolonged immobilization. So they are not the standalone solution for managing pain. So I will repeat this line again and again because I have seen patients completely depending on cervical collar, which shouldn't be there. So we should address the root cause of the pain, and we can assess it through a targeted medical movement. Then we can understand through a thorough assessment, and then proper exercise, proper stretching regimen, then physiotherapy, then some lifestyle modification is more often it is more effective in long term. So cervical collars are not the solution for neck pain. Now I'm going to talk about more on immobilization versus mobility. So basically, our first point centers around the importance of maintaining mobility in the neck. The human spine is designed for movement. You need to understand that. So keeping it immobilized through prolonged use of cervical collar can actually lead to muscle atrophy and stiffness and a decrease in overall neck function. Instead of immobilizing the neck, evidence supports the benefit of controlled and gentle exercises and stretches to improve strength and flexibility. Now the second point, which is very important, that is the risk of dependency and muscle weakness. Muscle weakness I've talked about it earlier as well. So now I'll talk about the dependency. So the cervical collars, when used for extended periods, it carry the risk of creating dependency. And you know what? Muscle needs regular activity to stay strong and healthy. It needs blood supply. So if you wear a collar and keep it immobilized for so long, obviously the blood circulation to muscles will get hampered. They will not get enough nutrition that is required. So basically, cervical collar exaggerate the problem rather than addressing its root cause. So we argue that more holistic approach, which will involve a targeted exercise regimen, is actually more crucial for long-term relief and recovery. Third point is, there is a lack of evidence for efficacy of cervical collar. Despite the common use, there is a lack of conclusive evidence supporting the efficacy of cervical collar as a standalone treatment for non-specific neck pain. Many studies have suggested that other interventions, such as, I have repeated again, proper exercise regimen and lifestyle modification, are more sustainable solution for managing neck pain, and we should prioritize evidence-based practices over traditional method that may lack scientific support. So this is very important thing, that we should encourage more evidence-based practice. So in research, it has been proven that cervical collar is just an additional support. It's not a it's not a cure to your problem, and you need to understand that. So also, I want to say that cervical collars are beneficial. I'm not saying that we should disregard this collar thing. So thank you so much. Stay tuned and see you all in my next video. Thank you.